Psychoanalysis, developed by Sigmund Freud, is one of the oldest and most influential approaches to understanding the human mind. It focuses on uncovering unconscious conflicts, childhood experiences, and inner drives that shape personality and behavior. Modern psychoanalytic therapy continues to evolve, incorporating both classical and contemporary methods. Below are the key techniques, concepts, and limitations associated with psychoanalysis and the broader psychodynamic perspective. Core techniques of psychoanalysis include 1. Free association. Free association involves encouraging the patient to speak freely about thoughts, feelings, memories, or fantasies without censorship. This process allows unconscious material to surface, revealing hidden conflicts, desires, or unresolved issues. 2. Interpretation. Interpretation is the therapist's explanation of the unconscious meaning behind a patient's thoughts, behaviors, or dreams. Skilled interpretation helps patients gain insight into their internal conflicts. Timing and sensitivity are crucial to avoid resistance or rejection. 3. Dream analysis. Freud viewed dreams as the royal road to the unconscious. In dream analysis, therapists help patients explore both the manifest content *, the actual dream narrative, and latent content *, the hidden symbolic meaning. Dreams often express repressed wishes or unresolved anxieties. 4. Analysis of resistance. Resistance refers to the unconscious defense mechanisms patients use to avoid confronting painful material. This might include missed appointments, changing the subject, or intellectualizing feelings. Recognizing and working through resistance is essential for therapeutic progress. 5. Analysis of transference. Transference occurs when a patient projects feelings about significant people from their past, often parents, onto the therapist. This can be positive transference, feelings of affection, admiration, or dependence. Negative transference, feelings of anger, mistrust, or resentment. Therapists analyze transference to reveal unresolved conflicts and relational patterns. 6. Countertransference. Countertransference refers to the therapist's emotional reactions to the patient, which may reflect the therapist's own unconscious processes or a reaction to the patient's transference. Understanding and managing countertransference is essential to maintain objectivity and effectiveness. Types of transference and countertransference: repetition transference, reenactment of early relational dynamics. Parental transference, therapist is seen as a parental figure. Sibling transference, rivalry or companionship projected onto the therapist. Erotic transference, romantic or sexual feelings projected onto the therapist, must be ethically and therapeutically contained. Some key psychoanalytic concepts are Freudian slips, also known as parapraxis. These are seemingly accidental slips of the tongue, forgetting, or misreading, which reveal unconscious thoughts or desires. Supportive confrontation, a technique in which the therapist gently but firmly confronts contradictions or defense mechanisms in the patient's narrative, encouraging reflection while maintaining a safe therapeutic alliance. Boundary setting. Clear and consistent boundaries in time, space, and roles protect the therapeutic frame, creating a secure environment for deep psychological work. Working with resistance, the therapist identifies and respectfully addresses resistance, viewing it not as opposition but as a defense against psychic pain. Techniques include empathic listening, validation, and exploration of the underlying fear or conflict. Guidelines for interpretation. Interpret at the right emotional moment, when the patient is ready. Link interpretations to the patient's current emotional experience. Use simple, clear language. Avoid overwhelming the patient with too much insight at once. Interpret resistances before deeper content. Psychoanalytic personality theory sees personality as structured into 3 components: id, primal desires and instincts, pleasure principle; ego, reality-oriented mediator, reality principle; superego, internalized moral standards. Conflicts between these structures produce anxiety, which the ego manages using defense mechanisms, like repression, denial, projection. Freud also proposed two fundamental drives. Eros, life instinct, includes sexual and survival instincts, promoting creativity, love, and connection. Thanatos, death instinct, represents aggression, destruction, and a drive towards self-destruction or return to an inorganic state. These opposing forces often conflict and influence behavior in complex ways. Psychodynamic perspectives. The psychodynamic perspective evolved from Freud's theories, incorporating insights from figures like Carl Jung, Alfred Adler, Erik Erikson, Melanie Klein, and object relations theorists. Modern psychodynamic therapy is typically shorter-term and more collaborative, focusing on patterns of relationships and emotional functioning. The psychoanalysis and the psychodynamic approach it is not without criticism and limitations such as time and cost. Classical psychoanalysis requires frequent sessions over several years, making it inaccessible for many. Lack of empirical evidence. Some Freudian concepts, such as Oedipus complex, death instinct, are difficult to test scientifically. Cultural and gender bias. Original theories were based on Western, male-centered assumptions that may not generalize across cultures or genders. Determinism. The emphasis on early childhood experiences and unconscious determinism may underplay personal agency and current life context. Overemphasis on pathology. Psychoanalysis can focus heavily on dysfunction rather than strengths or positive growth. Still, psychoanalysis remains a foundational pillar of modern psychology, offering profound insights into the human psyche and the origins of emotional suffering. Techniques like free association, dream analysis, and interpretation, along with core concepts like transference and unconscious conflict, continue to influence many therapeutic approaches. However, modern practitioners also recognize its limitations and often integrate psychoanalytic ideas with more empirical, culturally sensitive, and time-efficient methods. When used thoughtfully, psychoanalysis provides a rich framework for deep, transformative therapeutic work.